Solidarity forever.
The Kenya National Union of Nurses and Midwives have issued a stern warning of an imminent industrial action set to begin on January 13th if the government fails to address their critical concerns before and during their dialogue set for January 6th.
We are ready for dialogue, but the dialogue must only lead to one thing: conversion of nurses on contract to permanent and pensionary. But as we address, the nurses at the counties will be on strike from 13th. We will not be waiting for those dialogue, because those dialogue can happen, but that anybody in government doesn't know that these nurses exist.
The nurses and midwives issued several demands. Chief among them is conversion of nurses from contract to permanent and pensionable terms, implementation of their 2017 CBA, employment of more nurses, promotions, recognition of nurses as a directorate in the Health Act 2017, and implementation of a career progression. And on issues of allowances and delayed salaries.
Isitoshe, tumeweza kuona pia kwa serikali za kati kuwa zinafanya hivi, zinachelewesha mishahara ya wauguzi, wafanyikazi. Kuna ile tunasema zile pesa wanatukata za kuweza kwenda hospitalini, na pia mambo mengine kama loans tumezichukua.
They have further decried the exploitation of specialized nurses and failure to employ nurses under the universal health care coverage.
There is no way we have nurses working, like, for example, in theater, in maternity, doing the same services, but when it comes to payment, there is a difference of even 50,000.
Nairobi, hoy!
Hoy!
Meanwhile, the Kenya Environmental Health and Public Health Practitioners Union have warned that Kenyans could be consuming fecal matter and mercury that pose grave health risks.
It will interest you, Mr. President, or rather surprise you, that Kenyans have been consuming fecal matter. Heavy metals like mercury in tea. I'm sure we take tea every day. Exposed to dangerous hazardous waste like electronic and radiological waste that claim several cancer cases.
This comes even as they vowed that they would be downing their tools come January over failure to prioritize resource allocation towards preventative measures and failure to employ public health officers and interns.
Kama tutasikizwa na ministry ama wizara husika ya masuala ya afya, itabidi ikianza Januari, ikianza mwaka inakuja 2025, it's not going to be a good year for us as public health officers. Mobilize, tutaitisha watu wetu wote. All our members will now down tools, hatutafanya kazi. You must know that there are PHOs who have been serving under Universal Health Care Program. And their contracts were extended to close to, this is the 5th year they are serving that contract. And the law prohibits somebody serving to that extent. If you look at even their salary, they receive a meager salary. Some of them are paid 30,000.
Calling for dialogue, the practitioners are demanding proper representation in the Social Health Authority Board, purchase benefits and SHA, restructuring of the Public Health Council, regulation of community health promoters, and recruitment and confirmation of public health officers.
Solidarity forever.
Harriet Chimea, K24.